Hey, this is Patrick Comiskey in Albuquerque, New Mexico at Eye Associates. Just wanted to talk through this case here. This is a patient with an intumescent cataract following a full thickness cornea transplant that was done, I think, for keratoconus with the central scar. Anyway, I tend to wait, a year before taking out the sutures, and then maybe 3 months after taking the sutures out for getting fresh measurements for the cataract surgery. So this patient has waited a while to have this, and he's had this terrible cataract in. He shared that he was even starting to lose a bit of hope that he could get some vision back. At the beginning of the case, the intumescent cataracts, I tend to like using blue dye, of course, and then the 27 gauge needle to aspirate, the intumescent kind of pressurized fluffy material in there. And I'm just using my kind of normal cross chop technique to break up the relatively hard center of the cataract. Apologies here for having the video a little bit off screen. My view, in the microscope is quite a bit broader than what gets recorded, so I'm going to try to work on, getting you guys some better videos. But maybe we'll just jump past this a bit. Okay, well, never mind. Looks like the cataract's out there. A little bit of adjusting of the microscope. And man, you can already tell that this patient's going to have a much better view without that terrible white cataract. Getting out some of the cortex. This was a super deep chamber, so it's kind of a little bit funny to look through. Yeah, just the optics are really something, with a bunch of astigmatism, really deep chamber. Here comes our beautiful lens. I love using this, enVista's, B&L's enVista lens for the corneal ectasias because it has no spherical aberration. So I think it gives real, nice as a picture as you can get. But there's a beautiful case, and this patient is super happy. Well, thanks for watching.